Hi, good morning. I'm Dr. Parthasarathi Reddy, Managing Director of FMS Dental Hospitals and Dean Sri Sai College of Dental Surgery. I started my practice, especially the organization of FMS Dental, in the year 1993. And the last 3 decades, I have seen a lot of changes in the treatment protocols. So with the advancement in the digital dentistry, and also applications of AI in our practice, various specialties like implantology, orthodontics, occlusion, or even the cosmetic dentistry. A lot of changes have come in with the applications, and now the way we practice is entirely different from the earlier days. In the implantology, today with the help of CT scan and various softwares like Exoplan, Blue Sky, etc., we prepare a guide which fits exactly, and implant will be positioned exactly in the place where it has to go, and also the crowns can be fixed immediately. It helps many of the even the beginning dentists to place implants exactly, and also will help the positioning of the implant in such a way it looks aesthetically good. And today the new trend is the robotic practice in implantology. The AI-driven robotic practice in implantology is now the incoming into the dental practice. When we think of orthodontics, in the last 3 decades, we've been using the braces regularly, but today 80% of practice is moved the digital solutions like aligners. We scan the patient's bite using the softwares like 3D Mastro or Archform, etc. Various softwares are there. We use some of the softwares. We position the teeth, what exactly should be the final outcome, show the patient the simulation, and once the patient accepts, and we give the plan exactly, and the aligners given with the time frame exactly fixed, and patient knows also when the treatment is going to be completed. So this kind of approach, which is Invisalign as well as the digitally exactly getting the plan what we are supposed to get, no assumption, but exactly the predictability, precision is being brought in from the day one up before start to finishing. And when it comes to the bite occlusion, earlier we used to use a occlusal papers, articulating papers, where we used to see carefully the intensity of the color. Where it is more, we used to adjust. But today we have the digital sensors like T-scan, which will put the bite and can see the forces, and every tooth can also see the left and right, can also see the movements, and where the forces are obstruction more and there is obstruction, adjusted so digitally, and patient himself can see on the screen how well his bite is balanced. This will help the treatment of the TMJ and also the other parts of the full mouth rehabilitations, etc., and which makes a big change in the practice of the especially the prosthetic rehabilitations. And cosmetic dentistry is to be a big the challenge for us, where we never used to what we say to the patient, always they used to think, and what they want we used to assume. But today with the softwares like DSD and Smile Fry, there are various softwares where patient can see himself with some apps, and we can scan the patients this thing and put the photos and match them with the sometimes with the CT scans, and position the teeth exactly and show them in the digital software and show them in the videos how it's going to be the final outcome. With this, the patients can really assume at least 90% of that what is going to be achieved. So this prediction will help us to the patient's expectations to be realistic or not, make them understand, then start the treatments. Makes a big change in our practice in the cosmetic dentistry. Not only this small this thing, even for surgical approaches, orthodontic surgeries, etc., various softwares we use like Dolphin, etc., where we show the patient before, after, and where they know exactly what is going to be the outcome, and if they are convinced, we can go with the treatments. Besides this, a simple treatment the simple patient management softwares are also available with the records of the photos, their data, their radiographs, the treatment plans, everything being put in a proper way. This digital and AI-driven solutions is helping us to move forward with a better predictability, better precision, better able to understanding between the patient and us, and it's going to be the future. There are applications in various fields and various specialties of our dentistry is going to be the future, and we are constantly upgrading ourselves with the various new digital solutions in every field of this thing, even from a simple filling. Today we do with the the digitally planned fillings where we can fix it like inlays. Earlier we used to do with wax, today we can fix. And the most important is lab technology. When we started lab in 1997, we used to take 3 days to prepare a crown, because we used to wax up, then cast it, then fit it, and then trim it, all this. Today we just scan the patient, and then within seconds, it takes us few minutes to scan, then within seconds it's there in our lab, and my chief technicians and the doctors do prepare it with the softwares and the CAD/CAM solution. It takes maximum 6 to 8 hours or maybe about 10 hours to prepare the crown and back to the clinic. So